I've been having pain for years, and I've been through physical therapy, I've had spinal injections, and I think the last injection is what set it off because it almost left me paralyzed. Couldn't walk.
Desperate to overcome years of suffering lower back pain, Jackie Ogunwari is experimenting with non-surgical treatment. Refusing the surgery her previous doctor recommended, Jackie is trying an intense exercise-based rehabilitation program at New England Baptist Hospital in Boston. It is so tough, it has been called boot camp for back pain victims. A former runner and West African dancer, she's been rendered helpless by back pain. She has to use an elevator to avoid even one flight of stairs.
You're very deconditioned because you've avoided your pain, and that's natural and normal. You have pain, so you stop doing activities.
Right.
The more you stop doing activities, the less it takes to provoke your pain.
Okay.
We see the disc here. You had a scan about 5 years ago, and the disc looks about the same now as it did then.
Okay.
So that gives me certainty that you can have this disc and feel well like you did before you recently hurt yourself.
Okay.
Have you been told that it's okay to bend from the back?
I've been told to don't do anything right now because I may need surgery.
Okay.
So I just refrain from doing that and just continue, having pain.
Right. So Jacqueline, this is the gym where you'll be working out, and if you follow me in here, you don't usually wear a skirt, but this is what you do. See, I have to have a strong back to do this, and then I can do this. Okay, so this woman is lifting weight using her back muscle. She's not bending from the knees. She's actually using her back. You can't be afraid of your back to lift like that.
Here, the goal is not necessarily an end to all pain, but to regain enough strength to enjoy mobility again. It's not going to be easy for Jackie.
I'm looking forward. I just want to get back to Jackie. This is the very first time that I felt hope. I cried when Dr. Hodigan told me about the rehab program because I felt and I feel that surgery is just not the thing for me. I've seen people have back surgery. Some of them are paralyzed. Some of them can't walk. And I just did not want to end up like that.
Boot camp consists of 12 90-minute exercise sessions over 6 weeks at about $250 a session, depending on insurance. First, Dr. Carol Hartigan weans patients off heavy narcotics, which prevent the brain's natural endorphins from being produced.
And exercise causes an increase in the level of endorphins. So what we're doing partly with the exercise is we're working to stimulate the endorphin release.
Patients must be convinced exercise won't injure them.
This is counter to what they've been told often by therapists. Don't bend your back. Don't even bend to put anything in the garbage. And we say, no, we want you to bend and get your back into it, and we want you to actually lift some weights off the floor and put them on a shelf. And next time you come in, we want to put another weight in there.
Okay, let's see. First set of weights, we're going to try this. We're going to try 2 plates for 10 repetitions pushing up, okay?
Okay.
So, leg up now, get the leg up.
After working out for 2 weeks at the boot camp at New England Baptist, Jackie is seeing some changes.
Oh, I feel great. I'm smiling now. I'm happier. I am sleeping at night. I can't believe it. Honest to God, it's really a good change. I'm a little stiff, but I'm stretching. I'm walking 15 minutes a day now, and I'm just fighting the pain.
8 counts, right heel front. Ready?
Now, 4 weeks later, Jackie is still in pain, but take a look at her progress. The woman who couldn't climb stairs a month ago is doing aerobic dancing.
Okay, what am I, 80?
Jackie, we're going to go 100 pounds.
Oh, Jesus.
Dr. James Rainville has spent his career studying the mechanics of back pain.
All right.
Dr. Rainville believes he can re-educate the nerves that have memories of pain.
Where they move, it hurts. but that doesn't mean that that movement caused harm. It simply means that they have sensitized tissue in their back, so it produces pain very easily.
Legs.
Wow, Jackie, remember that first day when you watched?
Yes.
How you doing?
I'm doing it. I'm getting there.
Now, your goal over there is going to be 30 to 40 pounds.
Oh, Jesus.
Okay? So that when you travel, you'll be able to easily
Carry my luggage. Okay.
Even picking up grocery bundles.
Uh-huh.
A lot of people say picking up dogs,
Yep.
grandchildren.
Yes.
Okay?
I can pick them up now? Great.
Pain is produced simply by switches turning on. In our backs, we have millions of switches, and they're made to turn on only when damage or harm is occurring. But for a person who's experiencing pain every time they stand up, every time they sit for 10 minutes, when they put on their socks in the morning, that pain is not being caused by ongoing damage or harm. It's being caused by oversensitized switches. In other words, their pain is not accurate.
Thank you, Jesus. This is the end of my session for today.
This isn't Lourdes. This isn't some type of miraculous thing. All we're trying to tell people is that they can function at a higher level with their pain problem, and if they function at a higher level, they're not going to experience more pain. In fact, what they experience is less pain, a more normal lifestyle. It's amazing.
Jackie has one session left at boot camp, and she's been hard at work for 6 weeks.
7, 8, 9, 10.
Remember where you started at?
No, what was
You were
I?
at 70 pounds. You basically have more than doubled your weight.
Oh, yes. How many want?
Just for
Not only does she now have a body that jumps, dances, and is strong enough to lift a grandchild, another benefit has occurred. No more pain.
I don't feel anything now. A little tightness, but no pain. None. I'm shocked. I'm starting to feel, but my clothes are starting to look better on me now. My face was like this, if not worse, when I came in. Actually, that's the first thing that gains, weight on me. And I put on 45 pounds. 45 pounds.
So you're starting to lose weight.
I'm losing weight. My clothes are looking sharp. I'm going to a wedding tomorrow. I'm going to be fly. And I can't wait to dance.
Don't forget to do your all-fours flexion, Jackie, just to stretch the back.
There are only a few exercise programs like this one across the country. New England Baptist is tracking its patients' long-term success.
The average person that we see has a moderate to severe amount of pain when they arrive, and they have a mild to moderate amount of pain when they leave. And we treat and keep data on about 2,000 people a year.
Boot camp can only be as effective as the patient is determined and committed to a difficult and often painful physical regimen. 10 to 15% drop out of the program.
As we tell people, this is not a treatment for pain, I tell people that they're going to meet therapists who don't give a sweet damn about their pain. The only thing these therapists care about is this person getting back to playing with their kids, about getting back to being who they are.
But choosing treatment for back pain, even for medical professionals,